Welcome to the Student Physical Therapist Insider Access page. Something I want to talk to you today about is about a different presentation that gymnasts and dancers frequently come to your clinic with. People that are familiar with repeated motions know that when it comes to the spine, we like to often use repeated extensions to treat this. And that is often not the case for gymnasts and dancers, as they typically have an excessive extension in the lumbar spine. So when you look at them in their extension, they'll probably be standing, and when they lean back, I can't demonstrate because I don't have as much mobility as them, but when they lean back, you'll see a ton of lumbar extension just right in this region, and where they'll become almost horizontal, but you'll notice their hips barely move at all. And that's because they have a lack of, I don't want to say flexibility into hip extension, probably more so motor control. And so one thing you can do to try and treat that, I'll show you a couple things, is actually getting into a kneeling position, and while maintaining a core contraction, maybe even a posterior pelvic tilt, having them lunge into it so that the motion of extension is coming from the hip. And you can progress that by passively lifting the knee into a little more flexion, and have them do this repeatedly throughout the day, especially before they get to their practices. Another one is up on the table, and you're in the exact same position. Now, when you're in the half kneeling position, typically, people will have a little bit of a pelvic side bend, maybe a little rotation, and it's often due to a lack of flexibility in the hips. So if you can get them to cue where you're trying to make the pelvis level, and then also you take away the rotation, just a motor control thing, and then while maintaining that, have them lunge, you again start improving the motor neural input to that area so that they can gain that hip extension actively. And then when you reassess the hip extension, you'll see a more even distribution of extension mobility from the hip and into the lumbar spine. Another thing that I occasionally use, but I don't see as much success with, is rolling techniques. If you work on going from prone to supine, leading with the lower extremity, so you force them to activate the extension motion from the lower extremity. A lot of people have a hard time with it just because they don't use it typically. And if it's a unilateral issue, maybe you'll want to address side glides. You'll check in standing and just shift side to side. And if they're hypomobile on one side, and this is typically with your patients with unilateral pain, you'll just load on that side and recheck to see, one, if the mobility improves, but also their pain. You can improve the lumbar extension pain and mobility by doing repeated side glides if that is their primary deficit.